Blood pressure, it's something your doctor always checks. But what do those numbers really mean? And why is it so important? Fun fact, the history of blood pressure measurement dates back to the late 1800s. The first blood pressure cuff was developed by an Italian physician, and it changed how doctors monitored heart health. By the mid-1900s, blood pressure checks became a routine part of medical exams in the US. But what's considered normal? And what should you do if yours is too high? Let's break down the basics of blood pressure, the risk factors, and how lifestyle changes can help. Blood pressure basics. What's normal and what to do if it's high. 1. Understanding blood pressure readings. First, let's talk about what those numbers mean. A blood pressure reading has two parts. Systolic pressure, the top number. This measures the pressure in your arteries when your heart beats. Diastolic pressure, the bottom number. This measures the pressure when your heart rests between beats. Here's how the numbers break down. Normal blood pressure, less than 120 over 80 millimeters of mercury. Elevated blood pressure, 120 to 129 systolic and less than 80 diastolic. High blood pressure, hypertension, stage 1, 130 to 139 systolic or 80 to 89 diastolic. Hypertension, stage 2, 140/90 millimeters of mercury or higher. Consistently high readings put extra strain on your heart and arteries, increasing the risk of heart attack, stroke, and other serious conditions. 2. Risk factors for high blood pressure. So, what raises your blood pressure? Risk factors include diet high in salt, sugar, or processed foods, lack of physical activity, obesity, chronic stress, smoking, and excessive alcohol consumption, age and family history. As you get older, your risk increases, especially if it runs in your family. Certain health conditions, like diabetes and kidney disease, can also raise your risk. The more risk factors you have, the more important it is to keep an eye on your blood pressure. 3. Why high blood pressure is dangerous. High blood pressure doesn't just affect your heart. It can damage your blood vessels and organs over time, leading to serious health problems like heart disease, stroke, kidney disease, vision problems. And here's the scary part. Many people with high blood pressure have no symptoms until complications arise. That's why regular checkups are crucial. 4. Lifestyle changes to lower blood pressure. The good news? High blood pressure is manageable, and small lifestyle changes can have a big impact. Here's where to start. 1. Eat a heart-healthy diet. Focus on whole foods like fruits, vegetables, whole grains, and lean proteins. Cut back on salt. Aim for less than 2,300 milligrams per day. 2. Exercise regularly. 30 minutes of moderate activity, like walking or swimming, at least 5 days a week. 3. Manage stress. Mindfulness, meditation, or yoga can help lower your blood pressure over time. 4. Limit alcohol and avoid smoking. Both are major contributors to hypertension. And don't forget, home blood pressure monitors are a great way to track your progress. 5. When to see a doctor. So, when should you see a doctor? If your blood pressure is consistently high, especially above 130 over 80 millimeters of mercury, it's time to get professional advice. If you experience symptoms like chest pain, shortness of breath, or dizziness, seek medical attention immediately. And if you have other health conditions, like diabetes, regular blood pressure checks are a must. Your doctor may recommend lifestyle changes, medications, or both, depending on your risk level. Final thoughts. Blood pressure is one of the most important numbers for your health, and keeping it in check can add years to your life. Take control with healthy habits, regular checkups, and smart choices. Stay informed and take care of your heart.